Hello and welcome to the Council of Delegates of the Red Cross and Red Crescent, where we set the policies and guidelines that shape our movement and unites all of our national societies. Extreme weather events like the recent floods in Central Europe are becoming the new norm as the impact of the climate change becomes clear. Europe is warning twice the rate as the rest of the world, which makes heat waves, floods, wildfires, and cold waves all the more likely. Reacting to these events is not enough anymore. We can foresee them and we can prepare them ahead of time. And anticipatory action is key to helping the communities who are impacted by these disasters. So today I am joined by Ms. Stefanie Lux from the German Red Cross, the head of Anticipatory Action. Hello, Stefanie.
Hello, Laura.
And Marat Kachkimbekov, the Strategic Development and International Relations Advisor at the Red Crescent of Kyrgyzstan.
Good day, ladies. Okay, we are ready.
So my first question goes to you, Stefanie. What are the key lessons learned from using anticipatory action in various countries, and how did it shape your approach over the years?
Thank you. Maybe I give a little bit of background on anticipatory action or forecast-based financing, as it was called for a long time. We really started this together as a movement in 2014-15 when we got piloting financing from the German Federal Foreign Office to pilot the approach in 3 countries, which were Bangladesh, Peru and Mozambique at the time. And it was really this new idea of, acting between the forecast or the warning and the extreme event happening. So really to use that window ahead of the impact of the extreme event. And as you know, in the Red Cross, we have really important and good projects for long-term preparedness, for long-term disaster risk reduction. We are super strong in facilitating helping evacuations once we receive warnings, and this we were already before forecast-based financing. But what is new now is that based on the warning, funding is allocated automatically so that we can take as Red Cross, as Red Crescent, additional actions that also cost some money to help the families protect their lives and livelihoods. And that's really what was new and what really makes a difference, because normally besides evacuating and warning people, we just didn't have the means to do anything else until there were the impacts and the donors gave money for response. So it's really a huge change. Since then, IFRC has created the anticipatory pillar by the DREF. So once these early warning thresholds are reached, funding is allocated automatically to Red Crescent societies or Red Cross societies to take these measures. And what started with pilots in 3 countries now has this fund, and now 69 national societies worldwide are working on protocols like these. So huge growth just in the space of 10 years. What have we learned? Many different things, and it's still a young approach. We are still learning. We haven't learned all there is yet. But for example, in the beginning, we very much approached it like a DRR project. So we looked at which are the most vulnerable communities, and then we developed plans for them. But then, of course, what happens? You prepare 3 communities or 5 or 6, you develop plans for them. And then you get warnings for everywhere, but not for those communities. So we really had that situation in Bangladesh that the cyclone went elsewhere, or in Peru that it snowed everywhere, but not in our communities. So we changed the approach to be more flexible, to work a bit like response. For response, we act as Red Cross, Red Crescent, where the impacts are highest, where the needs are highest. And for anticipatory action now, we also really try to make the approach so flexible that we can act where we anticipate the needs and the impacts to be highest. But of course, that's a huge work. And it really speaks to us as Red Cross, Red Crescent that we can do this, because we have volunteers in every community almost, right? So we can act anywhere. But of course, it's a huge effort, because often we only have a few days or weeks so to be there in time. And so we really also learned it's so important to not only focus on the what happens between the warning and the event, but also all the work in building the systems, building the capacities, strengthening the capacities necessary so that national societies are enabled to take that action within a few days and to protect as many people as they can. So lots of different learnings, and we're still learning the nitty-gritty today, I would say, as we are still improving our preparedness and disaster risk reduction. I think as Red Cross, Red Crescent, that's our strength, that we keep learning from our experience in the community. But yeah, those are just two examples of what we learned.
In which countries are you running anticipatory action programs?
German Red Cross supports in 25 countries, so a lot, too many to list. But for example, we have been working with Kyrgyz Red Crescent and also Tajik Red Crescent since 2018, also on developing such protocols for cold wave and heat wave in both countries. Yeah.
Okay, so the next question goes to Marat, and how has the Kyrgyzstan Red Crescent integrated the anticipatory action in its disaster preparedness strategies, and what were the successes that you have seen mitigating the impact of disasters?
Yes, thank you, Nora. So actually, I mean, from the very beginning, it was some kind of new activity for our national society. I mean, anticipation action. But we, as a national society, had already rich experience on disaster management and DRR in general. So, and of course, for our national society, introducing this new component, what was quite, very new, and from one side, but very interesting from another one. So, and actually, I mean, team of the national society worked quite well. I mean, quite hardly on that, with the support of the German Red Cross and International Federation, as well as other PNSs working in the country, meaning that it was some kind of big job done in order to develop this protocol and adapt them into the context of the country and the national society. So, and the unit was working, having some kind of working groups, having expertise from the German Red Cross, International Federation. Yes, and definitely, when you are starting something new, you experiencing some kind of challenges. Mm-hmm. So, and these challenges was that before heat wave and cold wave was not considered like like disasters, separate disasters. It was considered like consequences of the weather in different variety. So, and why I'm talking about this one, because it's very important to have proper understanding from the very beginning, and also to based on this understanding, knowledge, information, you are starting to build proper steps, how to build this good model to be integrated into the current model. And so it's like related to the classic process of KAP, knowledge, attitude, practice, meaning that this process required a long period of time. First, people started to receive information, the awareness is growing, then they are starting to changing their attitude, and only after this, at least 2 stages, they are starting to put it into the practice. Mm-hmm. So now we had some kind of period to work on that, and protocols are ready. I mean, both for heat wave and cold wave, and even more, they were tested and applied several times within our national society. So, and from my position, working on strategic development and organizational development, it's very important to provide systematization and integration these protocols and approaches into all activities, relevant activities of the national society. And also here, maybe it would be quite good interlinkages between disaster management activities and health, at least. So, because within health component, we are also working on developing another component which is called community-based surveillance, which is also requires a lot of information, trainings for our staff, and it's quite a good moment to integrate both of these components and to work with the community, with participation of the local authorities, government, and so yes, we have to work on that to systematize and to make it more, to have a more institutional approach using these developments.
Yeah, thank you for bringing up the communities, because that's what my next question is about. So we know that the most vulnerable communities are often living in places where there is not a proper and forecasting infrastructure. So how can we make sure to reach them with our anticipatory action? Yeah, if you like.
So I just want to also react to something Marat said that is very important, and a learning that maybe I didn't highlight enough. Anticipatory action, if it is to work, it has to be part of the disaster risk management systems of all of our national societies, right? It works better the better preparedness is established, but at the same time, if you do anticipatory action, it can also improve your preparedness level and also the response. We've seen that we are quicker with response because with anticipatory action we already anticipate what's going to happen and also prepare for the response as well, in addition to then, after the anticipatory action. For the communities, so our approach is quite specific, that as Red Cross, Red Crescent, we really have the ambition to go where the impacts are strongest. A lot of agencies and NGOs work with predefined communities, but for us that means then that either you always go to the same or you don't go where the impacts are strongest. We really want to go where the impacts are strongest. And yes, you need good data and you need forecasts to do so. So in all the countries that the Red Cross, Red Crescent works in, normally for the triggers, so the thresholds that make us decide to act, that are pre-agreed in those protocols, we normally work with the hydromet agencies of the country very closely. So with Kyrgyz hydromet, for example, for the Kyrgyz protocols. And we do see that there is a lot of readiness by a lot of these forecasting agencies to also work with us and work with the Red Cross or Red Crescent Society on improving the forecast to give us what we need, right? Because so normally in Kyrgyz hydromet we had the same, like they did issue cold wave warnings, but only like 2-3 days ahead of the event, because it was just a warning, it wasn't to unclench much action. But then we said we actually need more, we need like 5-7 days ahead. So then they looked at what they could do more, right? So we work with the National Hydromet to see what can be done, and there are like really good other programs like the Early Warning for All initiative. There is the cruise, so the WMO work to increase the capacities of national forecasting agencies. But sometimes also internationally in some countries we combine with international forecasting models. So if the National Hydromet Agency, for example, can only give us 5 days, but we need 10, sometimes there's for floods, for example, there's a global flood forecasting model that we can then use. So for the real activation where we distribute, we then in Bangladesh, for example, still use the National Flood Forecasting and Warning Center, but we get a few days extra to select the communities, to register the beneficiaries by using this global model. And so sometimes this is also something we can do. We have also in the past with these bilateral partnerships also sometimes given a little support with like an additional workstation or something for hydromet agencies to improve their forecasts. But in general, there are now other initiatives. That's not our main mandate as Red Cross, Red Crescent, right? So we really do count a lot on the assistance by WMO and other actors to improve this. But it's important that you don't only need the forecast, you also need a lot of other data, like to see who will be most impacted, poverty data, vulnerability data. And that's where the experience of, for example, Kyrgyz Red Crescent is so important, because they have this knowledge and data that we need.
Yeah. Thank you, Stephanie. So, in my understanding, it's a good opportunity to, to apply our humanitarian diplomacy approaches. Meaning what? Meaning that here, having this activity in the place, we can bridge different actors here. So, for example, government, Hydromet, local authorities, maybe any other actors working in this field, and also to direct these joint efforts to provide support for affected communities or communities that are under the risks, right? And so here, again, from strategic point of view, on the national society level, we have to make maximum efforts in order to have systematic approach, institutional approach, as I mentioned before. And so here we can use different other cross-cutting instruments like CA, PGI, because they are helping us to have better access to the communities and to have better engagement, volunteers from their side. And having all this in one place, in one package, we do our humanitarian diplomacy, which is a principal approach for all of us. I mean, for the Red Cross, Red Crescent. And having all of this, again, we should reinforce our efforts in order to have more conceptual work on climate change adaptation. And having this, we also should use all internal networks, I mean, within the Red Cross, Red Crescent. So, for example, we have Climate Change Center, we have, for example, ERNA, it's a European Red Cross, Red Crescent network on HIV, and substance abuse. Also, we have different other networks. For example, recently we had Turkic Red Network activities, meaning that joining all these efforts, we can do more. And also we can apply to external foundations. So, for example, we have climate change, we have Green Climate Fund, and as far as I know, Federation is having plans to apply for the support, and I hope that we'll be successful in this one, and we will continue to have additional funds and additional opportunities to work in this direction.
Okay, thank you very much, and thank you for joining us today, Stephanie and Marat, on this discussion on anticipatory action. And thank you everyone for following us today, and please stay with us also in the coming days throughout the international conference. See you.